I've had people in their 70s come for orthodontic treatment.
Okay, so let's talk about all things braces from the cradle to the grave.
So I think it's important to really understand that actually braces can happen at any time in life, and really from any age, kind of you'd expect around maybe perhaps 8 years old is that you may require it if there's functional elements that require adjusting. So you could be looking at braces from 8 years old. The most popular age group I would say is that 11 to 13 category. Once the baby teeth have all gone and you've got the adult teeth coming through, that's a classic kind of braces age. But the reality is you can have it at any point in life.
Yeah, and then if you go into like your 20s and 30s, there'll be people that have never had orthodontic treatment that suddenly decide they want to have it. There'll be people that have had orthodontic treatment, they haven't worn their retainers and things have relapsed a little bit and they'll want to have treatment. And then there'll be other people where, you know, in your 20s, your jaw changes, in your late teens and 20s. So the treatment that you've had in your teens might have fixed the problems then, but then the jaws change and the teeth move. And that crowding that can sometimes occur in your late teens and 20s, people want to fix again. So then they come back for treatment then as well. So, you know, there's that whole period then. And then I think there is a whole sphere now for adult orthodontics and beyond, isn't there?
Absolutely. I've had people in their 70s come for orthodontic treatment. I think it shouldn't be an inhibitor just because you've gone most of your life perhaps without having it. But if it's something that you want to look at, as long as the rest of your teeth and most importantly your gums are healthy, there's no reason why you can't have orthodontic treatment.
And do you think that the introduction and the invention of clear aligners has made an enormous difference to the adoption of orthodontic treatment for adults?
Absolutely. I think one of the biggest barriers is going around with those classic train track looks, which most people, as soon as you kind of hit late teens, you don't really want to have them on. So the fact that there's now alternatives, so there's the clear aligners, that's a really good system, especially for kind of more simple movements, or even lingual braces. So what that is the train track, but actually on the inside, so they're hidden. Just having all these options has meant that actually that initial barrier of having to go around for a couple of years with traditional train tracks is no longer an issue.
Yeah, such variety out there now. And the world of orthodontics has changed so much in terms of the way it's delivered, isn't it? You know, digital dentistry is, I think, changing the way that we are going to continue to deliver not just orthodontics, but all types of dentistry going forward.